Here's some great news. There is now a discreet way to straighten your teeth without traditional metal braces. It's called Invisalign. It's a technique that straightens the teeth gently using a series of customized, clear, removable plastic trays instead of those metal brackets and wires. And Dr. Swearingen and Dr. Bartolome are certified providers of Invisalign, and they really enjoy using this innovative technique to achieve stunning smiles. Doctor, it's nice to have straight teeth. They look great, but it's also kind of important from a dental health standpoint too, right?
Yes, it is. We want to make sure that the teeth are straight. The reason being is sometimes when they're crooked, the bite can be off, and that can cause problems in your TMJ. Also, the way you chew and function, if the teeth are crowded or you're not able to bring your teeth together properly, you won't be able to chew and function properly. The other thing too is for overall dental health and overall health of the body, we want to make sure that the gums are healthy. And sometimes when teeth are crooked, and either too tight and there's no space in between them, we can't floss readily through them. And as long as the bacteria stays under that gum line, we can have a periodontal disease. And periodontal disease is also linked to other systemic diseases like diabetes as well as high blood pressure. So for overall function as well as overall body health, it's really important to get those teeth straight.
Doctor, there was a time that if you had certain dental problems, braces were the only answer, but now you have something called Invisalign. What exactly is that?
Oh, yes, Ed. Invisalign is a great alternative to the old metal braces that were so uncomfortable and unattractive to patients. We now have the Invisalign, which is a clear, invisible plastic tray that fits very comfortably in the mouth. Every 2 weeks it's changed and very systematically moves teeth into the position that we want. It also allows the patient to take the trays out to brush their teeth, floss, and eat normally. And just they're a very comfortable alternative to the way that orthodontically teeth used to be moved.
So just what can Invisalign fix?
They can fix just about any problem that you encounter as far as orthodontic movements. You can close spaces, you can correct crowding, you can correct overbites, overjets, cross bites, pretty much the same thing you can do with conventional metal braces. Also, they seem to work faster than metal braces because they're more precise and planned. It's done by a computer program, whereas metal braces the movement of the teeth is accomplished by the orthodontist tweaking the metal wires and creating forces that sometimes don't quite go as fast as planned.
Doctor, can you give us a closer look at how Invisalign works?
Invisalign is a very fascinating technology. What we do is we take models of the mouth, actually take impressions, send the impressions, pictures of the mouth, and x-rays into Invisalign. And they have a computer model where all the information is put into a computer, and trays are generated from that move the teeth incrementally about 1/4 of a millimeter every 2 weeks until the goals of the patient are actually reached. It's an amazing technology that this has been around now for about 15 years, and they've treated over 1 million cases, and so they have a huge amount of data in the database to be able to accomplish these things that they accomplish with Invisalign.
Doctor, how long does the Invisalign treatment take? I mean, how long do you have to wear the Invisalign?
Well, typically Invisalign is as comparable to conventional braces as far as how long a patient is going to be in them. Actually, with Invisalign, it might even be a more accelerated process because everything is computer generated as far as the next sequence of trays. So we know exactly where the teeth are going to be versus when you have to bend conventional braces wires. They may not position the teeth in the next step that we want them to. But really, it depends on the complexity of the case. If we're just shifting teeth over versus rotating them or making large bodily movements, it really can vary of how long a patient is going to be in Invisalign.
Doctor, how much would a patient expect to pay for Invisalign?
Well, the price of Invisalign can be comparable to that of conventional braces. It just depends on how long the patient is going to be in Invisalign. And we also have to remember that Invisalign is an accelerated treatment in comparison to regular braces because of the fact that we can computer generate the next step, and it's more accurate than conventional braces. So with that, it's going to range between $3,000 to $8,000, the national average being about $5,000 for Invisalign treatment. And we have to think that patients can also have financing options, so they can get the Invisalign that they want and that they need, whether that's through care credit or paying as you go. There are lots of options.